Hey everyone, I'm Chelsea. I'm from Roosevelt University. I am part of APHA and I am currently the Operations Diabetes Chair. This week we are spreading awareness about diabetes, and today we're going to drop some knowledge and tell you about what diabetes is and some ways to prevent type 2 diabetes. I have some friends with me to help me out. So without further ado, hey Devin, can you tell me what diabetes is?
Hey Chelsea, yes, I'd love to go more into details about diabetes for you. So, in a person without diabetes, their pancreas is normally secreting a hormone called insulin. Insulin is what's going to stimulate our cells to uptake sugar when our sugar levels are higher in the bloodstream. We get higher levels of sugar in the bloodstream usually when we eat food. So when we eat that favorite piece of cake, or even just eating a slice of apple or a banana, will stimulate insulin to be secreted so that we can use all that sugar in the food to use for energy that we need to either run around or dance to our favorite song. That is all needed by the one hormone in our body, insulin. So in a person with diabetes, they have a pancreas that is secreting little to no insulin, or their cells aren't reacting to insulin as they should be. This can lead to many complications that would sometimes be fatal in people. So, with that being said, there are different types of diabetes that we can go more into detail about, and my friend Paul will tell you guys all about it.
There are about three different types of diabetes. Type 1 diabetes, which is also called juvenile diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes or juvenile diabetes can have an onset as early as infancy up to young adults. In a patient with juvenile diabetes, their pancreas does not make insulin, so therefore they need to either administer insulin via a injection or a pump. In type 2 diabetes, we see that adults are more affected, but children can be affected too. Type 2 diabetes can be managed with medications, insulin, or both, but it can also be managed with lifestyle changes like healthy foods and exercise. There's also gestational diabetes that can occur in pregnancy. So when a woman is pregnant, she experiences diabetes symptoms, but when she delivers her child, the symptoms go away. There is a risk for the mom to develop diabetes later in life along with her child. If you have any questions about your risk or if you experience any symptoms, give your doctor a call so that you can schedule a test with them. Can you tell us more about the symptoms, Joanne?
Some symptoms that may be of a concern and you should call your doctor is when you're experiencing going to the bathroom more often than usual, especially at night, losing weight, feeling very thirsty or very hungry, or both, having numbness or tingling in your hands or your feet, having blurred vision, feeling tired, having dry skin, or having slowly healing sores or infections. Specifically for type 1, patients may also experience nausea, vomiting, and stomach pain. For type 2, patient will sometimes not notice their symptoms or they might not have any notable symptoms. Now let's talk about some of the risk factors with E.
Thanks so much, Juan. Hi, my name is E, and I will be discussing some risk factors for diabetes. Some factors to watch out for if you're thinking you're at risk for diabetes include family history of diabetes, age. So type 1 diabetes, it can occur at any age, but it's more of a concern for children. And type 2 diabetes, it can occur at the age of 45 years or older. Overweight, history of gestational diabetes, physical inactivity, history of cardiovascular disease, hypertension, and or hyperdyslipidemia. Also, women with polycystic ovarian syndrome are at risk. And lastly, there are some ethnicities such as African American, Hispanic, American Indian, and Asian Americans that have high risk of diabetes as well. If you have one or more of these risk factors, consider getting tested for diabetes or pre-diabetes. So, what kind of tests do doctors do, Shams?
Okay, so there are 4 simple tests that can be used to assess for type 1, type 2, or prediabetes. The first test is called the hemoglobin A1C test, and this basically tells us your average blood sugar levels from the past 3 months. Normal levels are anything below 5.7%, and then anything at or above 6.5% may be of concern for type 2 diabetes. The second test is the fasting blood sugar test, which does require you to be fasting for at least 8 hours. Normal levels are anything below 100 milligrams per deciliter, and then levels at or above 126 milligrams per deciliter may be of concern for type 2 diabetes. The third test is called the glucose tolerance test, and this test also requires you to be fasting either for at least 8 hours or overnight, and your fasting blood sugar levels would be taken, and then you would be asked to drink an 8-ounce solution of sugar, and then after that your blood sugar levels will be taken 3 times, once at hour 1, and then hour 2, and then hour 3. And then the reason for that is just to see if your body responded normally to that sugar that you drank earlier. And then finally, the random blood sugar test, it can be taken at any time, regardless if you recently had a meal or not. So if your numbers fall between the normal limits, it is recommended that you still get tested every 3 years. And then if your numbers fell in that pre-diabetes range, it's recommended to get tested every year. And then Mustafa, tell us what else we need to know about diabetes.
Okay, there are ways to prevent type 2 diabetes through lifestyle changes such as weight loss, introducing a healthier diet, and physical activity. The best way to reach these goals is to include your family, friends, and loved ones in your plan to create a support group around you. People with type 1 and type 2 diabetes should keep these goals in their mind throughout their management of the disease. So a healthy plan is moderate in calories and carbohydrates and low in saturated fats with all essential vitamins and minerals. Physical activity goals include at least 150 minutes per week of moderate intensity exercise spread over at least 3 days with a break no more of 2 days between each activity.
Thanks everyone for helping me out today and dropping some knowledge about diabetes and helping me spread awareness about what it is. I also like to bring up an issue that us pharmacy students and pharmacists are seeing. We do see that there are increasing costs of insulin, making it difficult for people that rely on their insulin for diabetes management every day to be able to afford and have accessibility to this medication. So we are joining in with American Diabetes Association and signing their petition to stand up for affordable insulin. So be sure to check out their website and sign their petition today and join us in taking action. Also, please check out our references at cdc.gov and American Diabetes Association. Thanks!